All right, it's buyout morning. The trailer is actually driving in right now. It's going to be backed up here. We're going to be loading up the horses. If you've noticed, unloading. Sorry, I'm really excited and tired. If you've noticed, I've started wearing glasses because I've gotten old and my eyesight's really bad, but I have meta glasses because they help, because I'm dyslexic. I can't, like, reading's really difficult, and I can do voice to text everything through my ears that come through here, but it also does point of view. And I'm really, really excited because I can turn on a camera and you can actually see what I see. And what I see during buyout is crazy. So I hope you enjoy some of the point of view from my glasses throughout the day. But yeah, the horses they're coming right in.
There's the first look at them.
There are 8. 1, 2, 3, 4, 5, 6. Yeah, we did actually get 8 instead of 7. Okay. All right, we ready? Nobody's down. What we like. Do people who watch our videos know that it's not us transporting these horses? Yeah. Okay. I always wonder because, like, the level of...
Pull harder. Yes. If you're going to swing the big one, that gate might have to be manually moved up there.
This one right here is just gooping, disgusting snot. Okay. So let's try to get this one. Cody, are you available?
I was going to have Sydney grab it.
Or Sydney? Yep. So this chestnut right here, the super thin one, is just dropping giant globs of snot. So this one would be great. And that little chestnut baby right there that has a hernia. This one, yep, and hernia baby is also coughing.
There might be a string of his face somewhere.
Is it blue?
Yes, ma'am.
Okay. Thanks, Nicole. If you can't get that one, that's okay.
We need to keep these because we're going to need them to tie the
Got it.
dumpster bag.
Okay.
Was it this baby or
Yes, please. That one is a priority. And Sydney, if that's not doable, I mean, and nobody else looks like on fire, so we can just.
The one Cody has is going to be 207.
Hi. All right, stay out of the way of the pictures, Lydia. It's like I've never done this before.
Are they better out here for you or inside? Okay.
I really appreciate how calm this load is. I know that's very subjective, but often we get horses that are like truly distressed and down. No one in this load appears to be acutely distressed, and while I'm sure we have some lamenesses, I don't see any apparent fractures or dragging limbs, so that's always really encouraging. It does look like we have quite a few that have respiratory disease, and we've got quite a few that are very skinny. So, but overall, I'm always happy when we don't have like a crisis right off.
Yeah, it doesn't feel
right
like
off the
there's
trailer.
crisis mode right now. Everyone's like eating and like, this is a very nice change from the typical loads of horses we get.
Yes.
So,
and we haven't talked about it a lot recently, but if you have been watching Horse Plus videos for a while, this facility is new to us this year, and the design is just really lovely. So we were able to unload these horses in a very low stress manner and immediately have them not have resource competition. There's no bottlenecking in this barn. So it's just amazing, and it's nice and toasty warm inside. It's going to be a warm day today, but
Gail. Gail.
Yes.
Gail is the one who made that happen. She didn't want our staff to be cold. And if you've followed us for a long time, like our faces have been frozen in the wintertime, and like
we appreciate it, but it's a huge difference for these horses too to come. I mean, look how calm they are. They got off 2 minutes ago, so really amazing, and also helps our medical staff determine what's a true crisis and what could just be the anxiety of unloading. Nasal swab, and we've documented coughing. Hi, you all right? And Sydney, I don't mind if she has a little...
Sydney?
I'm sorry.
I'm gonna grab some blood.
Not paying attention, Cody.
You know, it's okay, because it's not, Sydney's not that bad to be called Sydney, but you were called me somebody else.
Good girl. Good job, Mama. Oh yeah, we definitely have lung sounds. Ooh. So this mare has a kind of a honk. When her caudal lung field fills with air, it goes like that. So that often is an indication that we've got chronic respiratory disease instead of acute. Is there any chance you could get her to step one step up for me? Perfect. Thank you. That's great. Oh boy.
I'm gonna get them more.
Do you guys see the line here and how she's breathing with abdominal effort? So sometimes we refer to this as a Heaves line, but Heaves is just one of the diseases that can cause animals to breathe. Normally, the act of filling the lungs requires no effort because of the negative space that's allowing the diaphragm to open. So horses that are having to breathe like this are having to actually use their abdominal muscles. I would love a CBC for sure. You're a good girl.
Not yet.
Okay, perfect. She dropped a huge glob of snot in hay out there. So just for the record, we've addressed this in previous videos. Because of zoonotic diseases that we've identified in these slaughter pipeline horses, and based on CDC's direct recommendations to Horse Plus, we are wearing respiratory protection and also gloves. You'll notice some of our staff are wearing gowns and others appear to not be wearing anything. We are adhering to really strict PPE protocols in that we are changing all of our clothes and decontaminating all of our things prior to leaving the quarantine area, but our staff that's immediately working with the horses felt that it was a little bit dangerous to have those gowns on. They kind of flap and get in the way. So if you're watching and you're going, this is super inconsistent, our practices are consistent, and we hold ourselves accountable to that. But if you're watching and it looks like we're doing different things, we're actually not. I know, Mama, I'm sorry. I smell your snotty nose too. Okay. We can go ahead and catch the next horse. Unsurprisingly, you are not microchipped. No, I don't want to have to sedate you to just look in your mouth though. So see how she's got food buildup in her cheeks right there? And her mandible is just totally, I can't move it from side to side, so.
So that's bad. Stop.
She definitely shows indication that she needs dental care. Let's call her 22 to 23. And also when we do her dental, we might have to correct that age. Hi. Does anybody want to volunteer? How about you, Precious? Oh, you so cute. You dropping your hay? Hi. There is appears to be a young chestnut foal that has a hernia. I don't think it's this one. Which, hey, I'm racking up the hernia surgeries, so I have one scheduled at the vet clinic coming up. Come on. Thank you.
All right, hang on.
Yes.
Before you get that one, you have to hold your stuff.
Got it? Okay.
I will hold this one.
Thank you.
So she can get pictures.
Wonderful. I believe we are aged.
And Liz is again doing all of our Coggins photos for us. Mike is filming for the weekly episode. He always does such a great job. Tawny over there is looking in the window at us, as you just saw a minute ago, and she's doing her stuff. And then Nicole is our awesome hospital manager, vet tech. And Sydney has been filling water buckets and is now holding a horse. One of our great horse handlers and horse people, and our adoption specialist. And then you have me. I'm doing almost live today because Justin is not feeling well. He was really bummed he couldn't do it for you guys, but he said, Dad, just don't talk too much. So I'm not going to talk too much.
You so cute. Hi. Yes, you're very sassy. You little hackney ponies. I know. I know, you're so cute. Good job, Mama. You definitely look like we've had some babies. Her cervix is intact.
Really skinny.
I would call her a bay. Yes.
With 4 socks and
Good job. You're so cute. Do we have that oral electrolyte gel up here? Thank you.
What would you body score her at?
Probably a 2. She actually has a good bit of winter coat, so you can't see quite as clearly, but I can easily palpate every single rib, and then she's got this really big indent here. So when we body condition score, we don't look at the abdomen, we look at specific parts where there are bony prominences. She also has a really recessed anus, so when the body loses condition, it kind of sucks in. Oh, she's so mad about that. It's terrible.
Oh, you got no teeth.
Yeah. Can you guys see this? So some of the primary teeth that we use to age horses are these ones over here on this side. Dental rads.
Okay.
Yeah. Unless you want to take them right now.
No.
Okay. You're a good girl.
Okay, Nicole's given her sedation so they can get some dental x-rays on this cute little pony mare.
Oh yeah. You definitely have the old lady mouth. Whoop. It's gonna have some movement, but. Well, you got a couple teeth left. Whoop. Okay. Yeah, we are missing 1, 2, 3, 4. You're a good girl. Nicole, I think I can actually do So our bottom left arcade is pretty much done, but our right side, top and bottom, come look at this, feels improvable. Let's do rabies vaccine and ivermectin. I aged her around 28. She's actually missing almost all of her incisors, so she's definitely a soup in the future kind of girl. I'm pretty concerned about her body condition score. It's very poor, and she's missing almost all the teeth on her lower left arcade, but her right side looks like it might be salvageable to the point that she could maybe chew some food. So age is just a number. Ooh, let's get that glob of nasal discharge before it hits the floor. Let me get a sample. Sorry for being distracted. So we did some dental radiographs on that little pony mare to see where we are prognosis-wise, but she definitely needs some dental work and some really intentional refeeding. Lovely. But her heart and lungs sounded good. Her gastrointestinal sounds were decreased, so she might just be dehydrated. We're gonna be really careful as we refeed her. And she only got one vaccine. I didn't want to bombard her, so I just vaccinated her against rabies, and she got a microchip and some dewormer.
So are those your new earrings? Is that the
They
idea?
are, don't you like them? I got the new little fur around them.
I think I've got everything else written down. Hi.
Well, you get some, I need some. I'm gonna try to get this in mine.
Stethoscope? Yeah, girl, I'll get you
I want
one.
one.
I got a bright pink one at home I can give you.
Wait a minute, right here, but her teeth, she seems to have a short.
Cranioventral left and right. And we've got some masses under the tail. So Nicole, this is what we were talking about this morning. Like normally, if you want to palpate that,
and I can see that.
it's pretty, that's a pretty typical.
That's what I was thinking.
And we've got 1, 2, 3, 4, I know. On the proximal underside of the tail, and one, probably like 1.5 centimeter diameter mass a little bit lower down.
So what do these masses seem to indicate?
Yes. And then we've got another 2 masses associated with the anus. So gray horses have a tendency to get a type of cancer called melanoma. Humans can get melanoma too. And you actually can see, some of these you can't see as obviously, but see this little mass right here? This is kind of typical of how we see it in earlier stages, and she's got a couple more near the entrance to her rectum. What's tough about melanomas is sometimes there are just a couple and sometimes there's a lot, and they can have tumors internally as well. So when I see a horse that's this thin and in this poor of body condition, it could be dental disease, it could be that she was starved, or it could be that, and melanoma is a neoplastic cancerous process. It's malignant, not benign, so it's a bad kind of cancer. Not the worst kind you can have, but we do worry about these guys. Many horses with melanomas can live years after their diagnoses. There's a new vaccine being developed to treat melanomas, but what we don't know is, I can confidently speak about these ones here. I don't know what's going on inside this horse's body. Okay?
Sorry, how old did you say she was?
25.
We're a boy, aren't we?
I think it's a mare. Oh, no.
Yeah, I was like,
No, I'm sorry. I got distracted looking under the tail. I'm so sorry. Yes, this is a gelding. I would call him an Arabian. He looks like he could be full Arab. Are you a little POA? Look at your naughty face. It's a little mare. Better suck those submandibular lymph nodes back in there, ma'am. Hi, cute pony. Hi. You're all right. Hi, ma'am. I'm sorry I got the gloves on. You're okay. We preg check her before adoption happens. She doesn't look to be aged out of reproductive possibility. Did you want to try a Foki?
It is a mare.
I think I saw an udder. Little dorsal stripe back here.
And then I need breed and color mark.
Yep, I would call her a Pony of the Americans POA, which we'd have to confirm with height, but I'm pretty sure she's pony sized.
Pony of the Americans?
It's an actual breed. Okay. It's an Appaloosa pony.
Okay.
Why am I so bad at horse colors? I feel like that should be something I'm good at. I just kind of wanted to see if she's halter trained or not, which she kind of acts like she knows exactly what this is. I think I can finish my exam without us doing a whole lot to her face, though. We just looked at a little pony mare. I called her a Pony of the Americans. She's got the little Appaloosa markings on her face. She's very cute. She's clearly not had great experiences with humans, so she's pretty distrusting of what we're doing, but she did allow us to examine her. I aged her about 15 years old. We are putting her down for a pregnancy check. We're not going to do that today because it's not going to change our course of treatment for today.
You're going to move too
Nicole's
much.
trying to get a blood sample on her. Sometimes less is more with these guys. Sometimes we do have to restrain them, but sometimes we're able to just kind of hands-off things. But she's responding positively. She's taken some treats. So other than some over-conditioning, she's a little bit chunky, which we don't always see here at Horse Plus. I didn't identify any major health concerns. From the outside, it looks like she's got really good teeth.
Trying to bite.
So she has some hoof neglect, which isn't surprising based on her behavior. But hopefully, with some decompression time and some positive interactions with people, we'll get her turned around and be able to take care of her feet. So we look to be about 2.5 to 3. You're doing great. We're keeping a really close eye on this old lady. She's 28, give or take, maybe a lot of years. I slightly sedated her because we needed to take dental radiographs, and so she needed to hold her head really still. So she chose to lie down. She is dehydrated. She did have some decreased gut sound, so we're watching her really closely for any signs of distress. But keep in mind, these horses that come through the slaughter pipeline, many of them are just exhausted. We're not going to let her lay here for the next 6 hours, but if she is laying down because she's been exhausted and now she feels a little sleepy, I'm kind of okay with that. But we do have some concerns. We pulled some blood. We're going to run some blood work on her. So we'll keep you posted on her. But she came in standing on the trailer. Whether she had been down and got back up, we don't know. So we'll keep you posted, but we're watching her closely. She's had some good pain control. She's doing great. So as far as like her own mentation goes, I don't believe that she's suffering in any capacity right now. It's cute.
Oh, wait, what?
She just sliced.
Never seen an ear like this.
Really?
No. Is it medical? Is it trauma?
No, it's an old injury, looks like. Let poke. Good girl, that was perfect. You're so good. That was good. We're all done. I know, that was scary. Good job. Yeah, so it looks like she ripped it a long time ago and it looks totally stable. Unless there's compromise to the blood supply, I just leave those.
How common are they? Like, you've seen it before.
Baby horses like to put their heads places where they should not be. So I've seen it pretty often. The ear is highly vascular, so it bleeds a lot, but what's great about that is ears don't get infected usually. If you get a big gash there, there's not a lot else going on. So even though they bleed a lot, they usually do very well. Hi, I'm just gonna look one more time at your toothfish. Yeah, okay, good job.
And how old?
I'm gonna round her up to 3, but she's young and she's being very good for being a baby.
The baby.
I'll be right back with
that's awesome.
some more pokes.
And just a couple minutes later, the pony's back up. Still sedated slightly, but up, eating. There's water literally right over there. So Doing pretty good.
Sorry, that took a minute. Okay. I don't think you have a microchip, but we're just gonna check. Good girl. Good girl. Okay, we don't like the pokes.
No one likes getting vaccines.
Well, we'll see how this goes. We still need to poke her 3 more times. So, I should have gloves on. You don't have the gloves. Oh, here. She doesn't want to take it from me. Now you're suspicious. Okay, one more. And I'm so sorry. We're gonna have a reaction to this probably. Okay, I'm sorry. Good girl. So we got 8 horses this morning, and from a different slaughter buyer, we're getting another load of horses. So because we don't know whether or not any of these guys have been in contact, we're gonna assume that they haven't, and we're gonna try to minimize infectious disease spread. We had a bunch of sick ones from this load. So we got through examinations of 5 out of these 8, but we know these other horses are gonna show up any minute. So we're turning out the 5 that we finished with. One of them I'm very concerned about. She's the little 28-year-old pony, and she's kind of getting up and down, but she has a heart murmur. Her GI sounds are not great, and I don't want her to go out and go down and not be able to get back up. So we're watching her really closely. The 3 we didn't get to, we're gonna push down to the end and do a little bit of a buffer stall so that when these next horses show up, we can try to minimize germ transfer between them. And I love our quarantine facility. So we've got a lot of different pasturing options. We have the 10-acre. We try to limit that to ones that we can easily catch again. But then even these smaller turnout areas have a buffer space between them. So she got back up again, that little Hackney pony. So we do have separate turnout options for these separate groups of horses, but we're just kind of regrouping and moving them around so that we can be ready for that next set of animals to come in. We got another piece of the puzzle that I didn't know initially, and that was that she was trying to lay down before we even looked at her. So some of our staff observed that, and we had a chance to kind of touch base on her case. I have seen her flank watch a couple times, which is when they kind of like look around at her belly. And laying down because you're tired after sedation would look very typically like one thing. Choosing to lay down when a bunch of activity is happening and you got a bunch of other horses around you isn't a normal behavior. And what we've seen from her is she's getting up, circling, laying down, getting up, circling, laying down. I did document dehydration. I did document decreased gastrointestinal sounds on her exam. And at this point, the teeny tiny little bit of sedation that we gave her should have worn off. So I do want to be really clear. We use the term sedation really lightly. She got just the teeny tiniest little bit of a drug that should be fully out of her system by now so that we could get accurate x-rays of her teeth. So this is one of those really hard things that we deal with it here at Horse Plus. I aged this mare at 28. I easily could have aged her at 35. It was a total guess. She doesn't have any teeth in the front. She's a very poor body condition score. She has a heart murmur. She's got something going on gastrointestinally, and she's a very, very poor body condition score. So in my opinion, it is kinder for a horse of this age who is dealing with something acutely wrong, which is the colic symptoms, as well as some chronic disease processes, the heart disease, and the dental disease. So I'm gonna recommend that we give her the last act of kindness. It's not a decision we ever come to lightly here at Horse Plus. And this little pony is so cute. And you can see her trying to eat, but what's happening is she's wadding that hay up and she's just dropping it back out of her mouth. So we don't want her to be painful. She did get pain medication. and she's continuing to show signs of discomfort through that. So we're gonna make a call on her. But I'm glad she got a lot of treats, and I'm glad that she's here and not in the mud in some slaughter auction lot.
So they've got the intake mostly done for these horses. They're already like turned out in the pastures. It's great to see. 3 more back there. I was in a Zoom meeting with our Horse Plus Legislative Coalition. We're doing a lot on the legislative level because basically enough is enough. We've been rescuing horses out of the slaughter pipeline for 22 years, and we are very dedicated to putting a stop to it, and that means on a legislative level, on a state level. So I had one of those meetings, and typically I go to my office and have it, but I was like, let's just have it here on the hay. And then we got to give them a tour of our facility, so they were really excited to see that. But yeah, and now we're just waiting for the next load.
Anything you hear inside?
So far everything sounds good. My biggest concern with this mare, she's got pretty severely bowed tendons on both these front legs. You can see how abnormal this is, and it is cold to the touch. So it looks like an old injury. We're gonna take some radiographs of these legs. She also has some pretty significant pain on palpation. Don't wanna cause her more discomfort, but she's reactive right up here in her withers. So we're gonna take some x-rays and check that out. And she's got a very, very snotty nose. So we'll take a culture sample of that. But heart and lungs, at least on that side sound good. I know.
She lifted her tail more.
Sorry. Okay, we can, no problem.
The other load of horses is almost here, so we're finishing up on this one, and then they'll be backing up here in just a minute.
Hi, big girl. I just want to look at your cheeks, is that okay? You good girl. Okay. Let me see this side. You good girl. I know. We'll call her about 17 or 18.
Oh, nice. 17 or 18. That's horrible. So somebody left a halter on, and it grew into her bone on her nose, actually, as a foal. And that's horrible. The other load is pulling back.
He's here. Okay. This is gonna be dangerous. Hi guys. Whoop, whoop. Whoop. Don't step on him. Whoop, whoop. Whoop. Whoop, whoop. Oh gosh. Okay. Okay, thanks you guys. Hi, baby, okay. Can I have some Banamine? Oh, we've got white gums. Oh, I'm sorry. It's a really old donkey. Let's do 3, please. I'm sorry, honey. Thank you, Tawny. Okay. Nicole, I'm gonna try to pull blood too. Get you some pain meds, okay?
Elizabeth, 215.
I don't know that I can.
Lady, I can take care of it later.
Okay, you want to get up? I just want to get you some pain meds, okay? Okay. Okay. I know. Let me get you some pain meds. All right, we've got total vascular collapse here. Okay.
So that is the Stallion. Sydney,
I might have to just go
you want to grab
orally.
this guy? He's the Stallion.
Tastes really bad, but
I don't know if we have somewhere we can
let me
put
try
him.
one more time.
Oh, yeah, look
Sorry,
at those back
baby.
legs. Unbelievable.
Okay. Okay.
We haven't counted yet. Yeah, but
Okay, Nicole, Banamine is on board IV, and here is blood from this little donkey. I lost my, here we go. There you go, baby. Okay. We're not gonna let anybody run into you. Can we get this donkey a bucket of water and see if maybe he wants to drink? Hi,
That's
are
the
you
blind
blind?
one,
Okay.
yeah.
Sorry, I stopped paying attention to anything else. I think this horse is totally blind, yeah. Hey, friend. Hey, friend. Hi. Okay. I need to pull up if he doesn't mind so we can get this gate closed. Oh my goodness, that leg. Oh my goodness. All right, we gotta get that horse some pain meds. If you guys can safely try to get a halter on him, let's give him 10 mils of Banamine. Okay. I don't want this donkey to get stepped on. What if we just tether this one over here for a second? Elizabeth, can you hand me that halter, please?
Lead rope.
Thank you. Okay. Oh my goodness. Okay, we'll get you some water too. Look, there's some water right here. Come here. All right, you guys, this horse cannot see at all, so please be careful. Easy, easy. There we go. Here's some water. You thirsty? Oh, I hate it when the blind ones are so thirsty. I'm sorry, baby. Okay. Feels so unfair. They can't see and they can't find their way to water for who knows how long. Normally we don't tether horses, but I don't want this blind one to step on our little donkey friend. Okay. Hi, guys. Tawny, do you think we can safely close here so he doesn't get stepped on again? Let's see if maybe we can pull him back a little bit. Okay, buddy. I'm sorry, baby. Okay. Okay. Okay, you don't have to get up. You don't have to get up. Are you blind too? Or are you just friendly? Okay. Let me back up, please. Thank you. All right, Elizabeth. I need, this horse cannot see at all. I need this horse backed up enough that we can close these two gates. He's tied, hang on. But I'm gonna keep him tied because he needs to be separated and I don't want him to step on his little donkey friend. Thank you, Jason. Mm-hmm. Okay, gotta undo this.
It's right here, Dr. Lydia, just this one.
This one won't open unless this one is unattached. This horse does not seem normal mentally.
Got buckets in the way down here.
What's going on with your brain? What's going on with your brain?
This water bucket too.
Yes. Do you want some hay? You want some water? Okay.
Let's
Elizabeth?
just swing this one here and call it good.
Okay.
We can just do this.
Yeah, that works great. Okay, let's do it. Do you have enough bedding?
Oh, there's some more behind you.
Hi, buddy.
Yeah. Okay. I bet.
He's just trying hard.
Well, I mean, you want a chair to stand up? Here you go. What do you think? His blood sugar is probably non-existent. Oh, he can't use this leg. There's an old fracture in this pelvis. Yeah, Tani, this is an old fracture. Yeah. Okay.
Okay, I just need that information.
He has basically no vascular pressure. Yeah, there is a fracture in this right pelvis hind limb, so just be careful. And he's at least 30.
You have one inside,
Okay.
and then that's the next
Okay.
one.
Did the stallion with the fractured leg get pain meds?
Yes.
Wonderful. Okay.
Did you get pictures of him?
So we got to figure out.
Oh, you guys, that leg.
So that she can get
So you can tie that horse. I would just tie him to the post, and you want to talk about the donkey while you're riding if you can.
Sorry, it's kind of
It's chaotic right now.
sometimes these guys. So this little donkey, I aged at least 32 years old. He has no grooves in his teeth anymore. He has a palpable old fracture that feels like it's in the proximal femur. It's unstable in this right hind leg. You can see how the leg kind of flaps out here. I say old because I can feel that the body has tried to make bony calluses, which takes 4 to 8 weeks. He was down in the trailer. He was stepped on multiple times. His mucous membranes are just white, like there's no pink at all. His lung sounds are just like if you take packing tape and just crunch it, he's just got horrific lung sounds. He has he's severely dehydrated. So it's just absolutely heartbreaking. Like, why would anyone not do the right thing to this guy and get him some pain meds? He's a little stallion and he's tiny and he's just in awful shape. So we gave him pain meds right away, but he's just trembling and unable to stand up and just in awful shape. So it's part of what we do is alleviate suffering. This looks like a really rough group. I try to watch him come off, but between this one and another one with just a flopping leg, I got distracted trying to provide pain meds. So, wow.
This beautiful stallion, that Palomino stallion, you start looking at his back legs and they just get worse and worse the more you look. So unbelievably sad.
Here, Cody, I'll look at him right where he is. If that donkey gets extra pain meds, I am okay with it. Hi, buddy. You're so handsome. Hi, big boy. I'm so sorry. You gonna be grumpy? That's okay. I'm sorry about your leg.
Okay.
What's really disgusting about this situation is somebody probably kept him alive to keep breeding him. It's just awful. It's just awful. And he's had full breakdown of the support limb. See, his right hind is just like sagged because he's, yeah. I would love to take radiographs. I don't think it's fair to ask him to do anything. I think we need to let him go and then take some postmortem radiographs. So you can see this left hind leg there's no way that leg is not fractured. And then the right hind leg is just support limb failure. He has had pain medication. Inexcusable. Hi, handsome. Oh, we gotta get a nasal swab too. He is 23, 24, 26. Old. I don't know how he's physically able to stand. Oh, his heart rate is crazy high. Awful. I'm so sorry, bud. I want to move him as little as possible. Like maybe we can try to.
Do you want him out outside the grass right now?
I'd love for him to get some grass. I don't, every step has to be so painful. Oh. All right. Oh my goodness. Yeah, I would let him move as little as possible.
You want to talk about him while he's in the background there? Like
That poor stallion is 25 or 26 years old, and his Left hind leg was fractured at some point. We don't know when. Looks like proximal fetlock is just snapped and dislocated. The right hind limb has experienced support limb failure. So he was trying to hold all of his weight on one leg. So both of his hind legs are affected, which is probably the only reason why he's bearing any weight on either leg, is that both his legs are painful. He's got pain medication right off the bat. His heart rate after pain medication was 60 beats per minute. So pain not well controlled at all. And it's horrific to think that this gorgeous Palomino boy probably threw colts with really beautiful coat color. And so somebody probably kept him around and kept breeding him with a broken leg, which is just, yeah. Looks like she's been dragging it. Sorry, bud, called you a girl. He did get pain meds, yes? Yeah. Okay. Yeah, I think so. Nicole is, thank you so much. I just want to make absolutely sure. This is the one that said, yeah, there's one that has a cut on its leg. He's got entropion in the right, so his eyelashes are rubbing on and causing discomfort on that cornea. And he has this huge wound on the front of his left front leg that's completely transected an entire muscle group right here down to the level of the bone. I don't have sterile gloves on. I'm not going to mess around and probe. But even without asking him to walk, I can tell that we've got decreased ability to ambulate, to move this leg because of the wear pattern on that hoof. His heart rate when he came in, I don't actually know, because we took one look at him and we gave him intravenous pain medication. His heart rate about 25 minutes after that was still 66, which is incredibly high. I gave him an opiate type pain medication that's as strong as morphine, and his heart rate is still 64. So to me, that is the definition of we have uncontrolled pain. Upper end of normal heart rate for horses is in the mid upper 30s. So this is a severely elevated heart rate indicating pain. This guy would need to have both of his eyes surgically removed and would have extended hospitalization to try to stabilize this infected leg. And I don't think it's fair to ask him to do that. So I'm going to recommend the last act of kindness. He's such a sweet boy. I didn't even really look at his teeth. I suspect he also has dental pathology, but. Hi, are you a baby? Sweet thing. Baby.
Because whenever I want to take...
You got the papilloma viruses? That's not a big problem. Thank you. Oh, you got some baby teeth. You're only 2? You're okay. I'm just gonna touch it. Okay. Oh boy. Holy cow. I don't want a lot of movement, but if we could get one step so I can see if we've got like nerve or what going on with this. Okay, that's far enough. Thank you. I'm sorry, I know it hurts. You're a good girl. Okay. I'm gonna sedate her. You're such a good girl. It might not be papilloma, it could just be sunburn. Yeah, you're okay. You're a good girl. She's dehydrated. You're a good girl, little poke. Easy wool. Good girl. It's not so bad. Okay. So this little Palomino filly's only 2. She's just gorgeous and super sweet. She's barely able to bear weight on this left hind leg, and you can see she's knuckled over and has been holding weight on the front. She also has a big slice on the back of that foot, and she really doesn't want me to touch it. So I can't tell if she had a club hoof that would be congenital. And if that's the case, there is a surgery that I've only done one time, but that one time was successful. There's a surgery that you can do to cut some of the ligaments that hold the foot to bring it into a more normal position. That would be something that we maybe could tackle. My concern is that if there's nerve damage, if this happened because of an injury versus something congenital, that changes the prognosis and the treatment options. If she is knuckled over because she's got a dislocation or nerve damage or something else, it's gonna be extremely difficult to impossible for us to fix it here at Horse Plus. So give her a little tiny bit of a sedative so that we can try to take x-rays of that leg and learn more about what's going on. She's also very irritated by flies. She has some open wounds. So I'm gonna try to get some ointment. And she's got this other little, I'm really not worried about this one at all. That little skin flap needs to be removed, but that one looks like it's almost healed. There's some dried blood there. So that's not my concern, but this is a major concern. You can see that she's holding all of her weight on that right hind leg. So that's not sustainable. Over the long term, we need to figure out why she's not bearing weight. She did get pain medication. First thing, Nicole gave her pain meds right when she got off the trailer. We need a third person to take rads. Let me see what I can do.
How has our x-ray been treating us recently?
Fantastic. Since they upgraded I always forget I'm on camera. Yeah, so the company we purchased the radiograph from was sold to another company, and that other company just absolutely went above and beyond. And we'd been having issues for a long time with this part of our unit, and they just sent us a completely new one. And we haven't had a problem with it since, so.
Nice.
That was really, they didn't have to. It wasn't even their product. They just did it because they like what we do and they wanted to support us, so.
Yeah, so a little backstory. Over the years, we've had battery issues and tablet issues and generator issues and charging issues and every issue you can think of to have. But it's great to hear that it's all fixed up.
She's been a little Gotta try to get further down. Okay. Whoop, whoop, whoop. Oh, yikes. Okay, let's try to take this. Okay. She is so cute. There's a gas tract. So let me set this over here and can you guys see this? I don't want to overstep with my interpretation. So this was obviously not diagnostic. But in this one, oh boy. Martha Marina. You can see some little chips of what appear to be bony prominences here, and you can see changes at the tip of the coffin bone here and on P2. And then you can't see all the way to the end of this coffin bone, but I do see some really concerning lucency changes right here. Probably the most concerning development in this case is that when asked to move that leg, she just drags the toe. So if she had a congenital club hoof, her nerve function to the leg would be totally normal. With a nerve injury, she was standing just kind of dragged it behind the other leg without awareness. So that is something, unfortunately, that I don't want to use the word confirmatory, right? Because I can't see in history, but if she does not have normal nerve damage to that leg, that is something I cannot fix. I can change the angle of that hoof maybe without surgery, but I don't know that we can get that leg back. And just kind of jokingly, you guys, I know prosthetic limbs have come up before, and I know there are horses and cows that have prosthetic limbs. And man, let's dream big and hope that that technology becomes more accessible. The reason why it wouldn't be fair to try a bunch of heroics in this case is look at this little filly. 100% of her weight is on that right hind leg. So we know that horses do not do well when they don't have a leg to use, and back legs are better than front legs. Horses bear 60% of their weight in the front, 40% in the back, but she's got 40% of her weight on that one leg. And the older she gets, the harder it's going to be on that leg. So if she's not experiencing it already, she's going to be experiencing support limb failure for that. It's just absolutely heartbreaking. She's so young and so beautiful.
And then her pelvis looks like it's really crooked to me.
Yes, great observation, Jason. What we can observe in her pelvis is asymmetry. So when you look at her muscles, the muscles on the right side are hypertrophied. They're bigger. And the muscles on the left side are atrophied. So if you look at her spine, it kind of dishes in here and it dishes here. That's called disuse atrophy. And it just means if you've ever broken your arm and it's been stuck in a cast and you take the cast off and you're like, why is my arm so skinny? We have to use our muscles to keep the bulk of them. And so this little filly experienced this injury long enough ago that she's just been dragging this leg around. And actually, it looks like her whole hoof has grown out from the coronary band all the way to the ground. So that also indicates months at least that this injury has been in place. You guys, maybe we can fix these feet. Question. Not that I'm proposing that we do this, but if we don't have rotation, what are the chances that we could put her under anesthesia right now and get Trey to fix her feet? Like as a stat. Don't jump the gun, Lydia. You got to take the rads first. Hi, you're so cute. Yay. Oh, yeah, good job. I know you don't know us. We're at least 5. I gave a little bit of sedation in the muscle instead of in the vein. Having worked with a few mini mules now, they are really committed to not cooperating if they don't want to cooperate. So we're going to let those kick in. Best case scenario, this is severe hoof neglect with some congenital club hooves that maybe our farriers can do something with. Worst case scenario, this is active laminitis. So without being able to safely get a heart rate and palpate for signs of digital pulses and inflammation in the feet, I can't tell which that is. So we're gonna wait a minute. I'm not very good at waiting. Hi, cutie.
This little stocky
You're
looking
such
horse.
a sweet face. It doesn't look like a quarter horse face, but I think that's our best guess. Her feet look so awful. I know.
I'm hungry.
I can put this baby to sleep, and he could do his best. We could try to do it like in the pasture so that she can just recover on grass, and we could just see if she's able to walk any better and actively work with her to try to get her feet picked up. I do think we need to be realistic that there's a really good chance we do that, and she's not actively foundering right now.
How old is she?
Yes, we can. She's about 5. I think it would be a one and done. I think we would.
Pizza's here and it's time to eat, so we're gonna be right back to helping the horses as soon as we're done eating.
Oh man, and I keep trying to use it, and then my body is like, don't use your thumb. Good girl. I know, you don't like stuff in your mouth. Good job. Sometimes you gotta divide and conquer.
If you can talk about this horse, because this is the
Absolutely.
first.
So we just took a lunch break. Thank you for pizza. If anybody's donated to our pizza fund, It's the best part of Viape. Sadly. No, you're okay. You can stay right there.
Well, it certainly lifts morale. The
It
pizza.
does live, food is always appreciated. So this little mare is about 19 years old. She's blind in both eyes. She does need both eyes removed. You can see how irritated they are, but there's no evidence of masses or cancer, and she's stable. So while I think her eyes are causing her discomfort, they're not causing her severe pain. Her resting heart rate is normal. So we're gonna schedule her for that surgery, but we're gonna run some blood work, make sure she's a good anesthetic candidate, and probably let her finish out her quarantine up here before we do that surgery. I know that looks like a big needle, that was her microchip. Other than her blindness, I didn't find any major concerns with her, and she's super sweet and really well adjusted to being blind. So I want to get some Aquaspot on her, and then she can just go right back here where she was. I wonder if those boogers on you were actually somebody else's boogers. I'm sorry. I'm sorry for scaring you. You're a good girl. Is your heart rate okay? Good job, Mama. Okay, resting heart rate is normal, so I'm gonna hold on the spanamine. Chris is a non-horse person. Which leg is the problem?
Which leg is the problem? He keeps moving.
Look here, come stand right here.
Right here. You can see it from right here.
Yeah.
I mean, I would guess the front right one, or front left.
You would be correct.
Yeah.
Yeah, that's a real,
His knee was real big.
it's a real big knee. We're about to take some x-rays. Are you gelding?
She wants smart.
Melanoma?
It does look like a mass, doesn't it?
Yeah.
I think it's like a septic arthritis case, but I don't even know.
Ooh,
That's a big. Can we take the lateral one more time?
Yeah.
It all feels bony, but it's like moth-eaten.
So Dr. Lydia, what did the x-rays show on this guy?
It's a great question. I am not a radiologist, so I'll try to characterize. So I was surprised by these x-ray findings. I'm also surprised by how comfortably this horse is able to walk. I actually didn't end up giving him pain medication because his resting heart rate was normal. That area on the carpus is rock hard. So I expected to find hard bone. And what I see is like these little gritty, grainy sponge area, for lack of a better description. It almost looks like a mast cell tumor to me, which is a bad kind of cancerous tumor. What's great is, though, this horse seems very comfortable to me today. So I didn't need to give him any pain medication. He seems comfortable and able to get around, which is great. He's about 25 years old. And thankfully, we have access to a boarded radiologist. So Dr. Marina has been reviewing the images that we take and going over them with us. So he is cleared for to decompress and get turned out into a quarantine pasture, and we'll look at those radiographs. But we always say treat the patient, not the diagnostic. So if you're comfortable and you're able to be a horse, great. We don't need to do a bunch of interventions, but I don't feel qualified or educated enough at this moment to confidently speak about those radiograph findings.
Did you have a rough day? Do you want to try some cookies? You want to try that?
You don't trust people, huh? Look at the angle on this leg. This is a very interesting.
Yes.
Jennifer, do you mind walking him right over here? I think he just has incredibly upright pasterns. Oh, yeah. All right. Let me do an exam first. It looks like conformation soft tissue.
Oh, you're not very old.
Why are you so skinny? I'm gonna go with 8. quarter horse, maybe an appendix. Is that an option? I'm trying to see. Can you step back for me, dude? Whoop. Okay. So we have a just incredibly toed in conformation. I'll try to show you guys if he'll let me what I mean by that. So if you look at this horse from the front, when he's squared up, his carpi are touching, and then this should be a straight line. And see how this leg is straight and this leg goes, mm-hmm. So that just looks like generally poor conformation. And then in the hind end, he's got very upright pasterns, so these angles. Can I touch you back here, buddy? This leg looks a little swollen too. Good boy. Jennifer, will you just let me know if he pins his ears? Okay, buddy. You're a good boy.
Listen, I don't think he's spinning.
Yeah, Nicole, I would love rads of the left hind. Jennifer, you can keep him right there. I'm just going to try to. You're a good boy. Okay. Not neurologic, so that's good. Yeah, man, this is very interesting. Actually, you can see from behind. So horses' legs obviously aren't perfectly straight, but look at this leg doesn't make a straight line from the hock to the foot. It turns in, and I think that's just this horse's conformation is just really poor. This soft tissue, this feels like all soft tissue to me, and it doesn't feel active. It feels cool to the touch and kind of old. So I'm not sure there's a lot we can do. It looks like there was an injury to this leg, and we'll make sure there's nothing bony. But I think this horse just has really poorly done backyard breeding, which is not his fault. But why is he so skinny if he is so young?
What'd you get for heart rate?
His resting heart rate was 42. If you're wondering about the pause, I only count for 15 seconds, then I have to do math, so. All of the way he's put together, that doesn't look normal.
Yeah, and then I took another one, and it was like weird.
Yeah. No, I'm just giving you the horse, thank you. Read my mind, Sydney. My husband says that all the time. He goes, I can't, Lydia, I can't read minds. Well.
And he's going to be going out in
We're
the
not going to
quarantine.
judge his ability to walk at this moment.
He's sedated, right?
He is just,
Yeah.
we were going for light sedation, but, you know. Hi.
Very sweet baby.
Oh, you are very sweet. Do you like the cookies? And no one likes the gloves. I don't like wearing the gloves either. I know. Hi. I didn't want to be wasteful. There was one glove left in the black thing. Why did you lose some hair right here? What's on you that's purple? Were you trying to graze over a fence?
It was from when Randy sprayed that crap. It was whenever the
Oh boy. So we talked about melanomas earlier. This horse also
Yeah,
pretty
let's see
typical. So you can see all these masses along here. You're okay. I know, it's very rude, I'm sorry. Okay, you're okay. Can I touch under here? Is that rude? Oh boy.
You feel them all?
Yeah, there's, I would say like 20 to 30.
So he seems like I wish he didn't go back out.
You got some DSLD too, huh? Can I touch down here? Oh boy. This is a fun one. You should come listen to this. So this horse has a very, instead of 2 beats, there are 3. Dat, dat, dat.
Yeah.
Mm-hmm. Oh, you got some masses in your mouth. Oh. Can you guys see this? Here. Yeah. Okay, I know. I'm sorry.
It doesn't feel
it's
good.
on both sides. I'm sorry. Okay. Can you see the swelling here? So it looks like it's on both sides.
Is that pretty much
can
all
see
the
it from the front.
cancer?
So I can't, without doing histopathology or a fine needle aspirate, I can't confirm that it's melanoma, but it's melanoma.
It's consistent with melanoma.
It is consistent with melanoma. We actually were able, the last case, to do a fine needle aspirate here, and just with our little microscope down in our hospital, we could see the melanocytes. And so this horse's masses are quite extensive under his tail. He has probably 30 of them, and they extend not just on his anus, but look like into the anus. And then I don't want to upset him, right? But when you look at him from the front, see how his lips on both sides stick out? So he's got bumpy masses extending. I was able to palpate inside on this one. So unfortunately, that probably means we have masses elsewhere, right? If we're having them outside the body. I need to see how old you are. I don't want to upset you. Can I look at your tooth for just a second? I know. Okay. I know. I got to see how old you are, my friend. Did you already pull blood on him?
Yes.
That's a big mass. He has a mass about...
That's not his lymph nodes?
No.
Right there?
Lymph nodes
They're
are...
like bilateral here.
Yeah. Lymph nodes would be like here. This is like associated with the mandible. So this wide in one direction by this wide in the other direction. You're such a good boy.
You don't have to drug you.
No, I don't want to have to. Oh, there we go for a second. He's such a good boy. Listen. Listen, I'm not going to hurt you.
There you go.
Okay, 27? 27 to 29? Okay. We'll go 28. We'll go 28. Oh!
All right, so guys, the little miniature mule was being trimmed by Trey.
It's way better.
And,
yeah, I agree.
You can watch that in the full episode. Michael was out there filming that.
Oh, did you guys want me to talk about her? Trey, thank you so much. Sorry guys, 1 second.
This one's really good. It just takes time.
Okay, I don't feel like I should be the one talking. Trey should be the one talking.
Not rolling anymore. We'll just
Yeah. So this little mini mule just recovered from anesthesia. She looks very wobbly, that's why. Better living through drugs. Trey did an awesome job on her front feet. So you can see it kind of looks like she's standing on her tiptoes, but what we want are for her legs have not been able to be in a normal position for such a long time that this is not a surprising result. We're gonna put her on a very grassy, soft pasture, so she's got really soft, gentle places to be. If she were a normal horse, we'd put her on stall rest, but for a semi-feral mini mule who hasn't been around people, I think our least stressful option for her is pasture. You can see Trey didn't get to her back feet because she woke up from anesthesia. We tried to give her a top-up dose and she was determined to get up. So we're gonna have to tackle those back feet another day, but the front feet were our biggest concern. The wobbliness is totally normal if you're watching this and worried. This is a normal anesthesia recovery.
She's not used to standing on it.
I'm really encouraged. Honestly, that left front looks better than I thought it would.
We've done it before and it's
Yeah.
worked well.
Keep her in your thoughts and prayers, and we'll hope for the best. But also maybe in the meantime, we can work with her to see if she'll let us start picking her feet up more so she can have better care. Thank you, Trey. Awesome job.
Yeah.
And also Tani, who I went out there, Tani was like holding her down. Okay, you're okay. I know.
Hi, friend. Hi, how you doing? Look at my duck again. Yeah, hi. Let me get you some treats.
It's a little mare.
Okay, your back hurts, huh? Good girl. Good girl. Good job, Mama. You're a good girl. She seems very nice.
Clean up once he's done walking, clean up the manure.
Okay.
Oh, yeah. Okay. Thank you so much. Good girl. So, Trey, if you don't mind coming in here and then right in the middle, we're going to take some x-rays of her.
If you're wondering who the new person helping is, that's Trey. He's a Navajo horse gentler, won the Wild Horse Res Challenge. And he's out here gentling horses for us, and that includes helping out today. So it's really awesome. He was able to trim up the miniature mule. Now he's helping hold horses because he's dealt with horses from the buyout, the ones that have diseases. So he's able to help out now, and he can't go work back down in the main area until he's disinfected. So he's just going to help out up here for the rest of the day.
I know. Oh, you good girl. Okay. Oh. Listen, I just want to see your teeth for a second. You're okay. You're okay. You got kind of some stinky breaths. Good girl, good girl. Good, very good. Good girl. She is right at 20. Nicole, it still says reconnecting, but let me select the spot and see if it's happy. Oh. Well, it's because Jason asked how it was working.
I take full responsibility for asking.
Oh, she's got a lot of mineralization. Oh. I'll show these to you guys in just a second. Holy moly. She's got that mare we radiographed last week that had arthritis in like every single vertebral facet. Hang on, let me switch the settings for this. Oh. Sorry, can we retake that? I want to go just a... Okay, and can we take a lateral dental rod to evaluate teeth, please? So obviously, in order to accurately evaluate something, we want to take two views, but this mare is not sedated. And to get the DP, I have to hold the ventilator over her head. So she's got a fractured tooth. There's a bunch of tooth bits in here, and then see this gas tract going up into the nasal cavity. So that looks like a fistula. And then her spine, she was very reactive to palpation. She's got some mineralization in her nuchal ligament. So these little chunks aren't a fracture. I don't think. We're gonna have our radiologist review them. This actually might be a piece of fractured bone. But these little tiny chips down here, I think, are a result of chronic inflammation in that soft tissue structure rather than a primary fracture. And then, ooh, that looks ouchy. See that little tiny hook of bone right there? So the vertebrae should be nice and smooth. So this one looks normal on the side right here. And all of this roughening here, 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 all of that is evidence of osteoarthritis of the spine. And it keeps going pretty much down her back. So this isn't classic kissing spine because these
vertebrae aren't touching, but you can see the irregular bone remodeling right here, and there, and there, and there, and there. So when I palpated this mare's back, she was very painful on palpation, and now we see why. She's got really severe osteoarthritis. Her sacroiliac joint, where the pelvis kind of meets the lumbar spine, is really painful on palpation, and I think it's resulting in a change that's causing that left hind leg to be much shorter strided than the right hind. Even at a walk, you can see that obvious lameness.
So explain what would happen if somebody had maybe bought this horse at an auction, and then
yeah.
they put a saddle on her and tried
Yes.
riding her.
So this mare has been nothing but super sweet and compliant with us. It's painful for her for me to even like run my hand over her back. So even if she was very well trained to ride, if you put weight on that back in any capacity, it's gonna hurt her to the point of a severe reaction. So sometimes people sell these horses, oh, this is a kid broke horse. Maybe they give it pain medication or something to mask that. And then somebody gets it home and they say, this horse is bucking my kid off. She can't, a lot of the time they can't help it. It's a pain response. But she also has, she didn't want me to touch her mouth at all. She's got some pretty severe dental pathology going on as well.
Are you good with her? I might go check her. 69. Not sure. Thank you.
We're not sure what we're walking into. What are we walking into? So this horse has a freeze brand on the side of the neck. 36136 it looks like.
All right, let's do a little sedation. Hi, friends.
She just wants to be with her friend.
Based on this, we have 5 more to look at, but I do not trust my number of how many we've gone through. I have no idea how many we've looked at.
Sounds fantastic.
I just found this and I put it on because I felt like maybe I took it off, but now I feel like it wasn't the right thing. I don't know.
That's the horse out here.
Oh, so we have 6 because Nicole has that one. So including this one that's coming in, we have 6. Yeah, it's only 2:30. We got this.
We have 5,
5.
because we already looked at the one.
Oh, great.
Need brads on it.
Perfect. Other than scars, I don't see any markings. That breeze feels really nice. Oh, these clippers. It looks like you moved when they did this, huh? 76136, 7G? 7G136. He's pretty sedated. And he was, I wouldn't call him sound, but he wasn't, like he passed proprioceptive placing and everything before sedation.
Galvani's groove is almost all the way to the bottom. So like late teens.
What's her brand say? 2009. So
17, 16. 16.
okay. I know, I'm sorry. Affirmative. Let's not forget to Equispot her too.
Yep, I got it in my hand.
Perfect. That she had, her cervix was scarred to the point that it was just like open. So I'm trying to do, but like, I do an external vulva exam, but I don't always like look inside, you know, which mares don't usually appreciate. Yeah, but if your cervix is open, there's no way you're pregnant. So when we pregnancy check a mare, we go via rectum or from the outside, so you're not always looking at the external vulva. So I'm trying to do that. Her cervix is intact, but she has a lot of scarring, so.
Poor
You're a
horse.
good girl. She's so thin, actually, we got a chance. Poke. How am I not in? I'm right there. She looks young. would call her a saddlebred. Girl. Good girl.
What a beautiful head.
Ah, she's only like 8.
You got a beautiful head.
Whatever it is affecting that left hind leg really significantly. She's so painful on palpation that I didn't even go all the way back there. She clearly communicated that her back is hurting. So we're gonna take some x-rays and see if we can find out where the actual problem is. What is that? Oh, it's a mat, it's her hair. That showed up on the radiograph.
Wow.
Can we retake that? I just wanna make sure. Can you go a tiny bit more, Coddle? Yes. Yep, that must have been her hair. All right. Nope, mystery solved. Is not outside the plate. Wow, this horse is so thin, you actually can see a lot. Ooh, kissing spine. Let's keep going back. Let's just keep going back here. And we're gonna have to have.
It's like way crooked.
Uh-huh. So this is the caudal spine, but look at all of that. That is not normal. That's also not super diagnostic. Look how different the settings. Okay, so I was shooting it on lumbar spine, but this horse is so thin, I changed it to thoracic spine. Yeah, that is abnormal, that is abnormal. Can we keep going? Let's take one that's like almost at the tail head. And then I'm gonna do immediately in front of the pelvis because I like this setting so much better. Oh, those are beautiful. That's a beautiful radiograph. So there's supposed to be a vertebral space right there and there's not. So this also, that facet, I don't know what's going on there, but that is not normal. That's not a normal joint interaction. Going the same way. This space is weird. It almost is like moth-eaten right here for a horse to be so thin. Like I can barely see these vertebrae, but those two are touching. Ooh. It's got another kissing spine lesion right there. That's lumbar spine. That's where she's painful on palpation. But her withers looked. Sorry.
Like that's.
Oh yeah, on the side. Sure enough, that's almost withers. And then she's got, I don't know what's going on right here. This is cranial scapula. That looks pretty reactive. See this line right here? And then we've got some mineralization in the ligament. But for sure, we're completely missing a vertebral space.
There. Yeah.
There, and then this, I don't know if that's a fracture or if that should be a space, but you guys see this line that we're talking about right here? Mm-hmm. So we're gonna have our radiologist review it, but unfortunately, this poor mare is really uncomfortable on that leg, even with pain meds.
I know Cody's not here, but we just have
Look at his jaw, you guys. This is an old mandibular fracture, I think. Maybe that's why you had a hard time eating that treat. You feel this right here, Trey?
Yeah.
Yeah. Can you move your mouth? Oh, you can't move your mouth very well. We probably need to take brads of this mandible. Oh, look at the baby tooth hanging on. So that's his 4.5 coming in, so. Are you almost 4? It's almost your 4th birthday.
He's a cute little guy.
He is cute.
Oh, wow.
Look at that.
Yep.
His tooth roots look pretty solid. All right, I need the DV. So I'm gonna try to kind of hold here, and you're gonna hold that underneath his jaw. Good boy. I really like this horse's brain. For a little stud, he's a very good boy. Oh, you moved at the wrong moment. All right, let's try one more time to get a straighter DP, and then I think we're good.
You're like, I'm stuck.
I mean, you can see where it is. Yeah. I think that's, I mean, I hope that heals up okay. We're going to have to wait and see if he can eat normally. But let's do all the things. His teeth look good. Do you guys want to see this fracture? Mm-hmm. So he had a fractured mandible.
Like, have we seen him eat?
Yep. So right here, this is the maxilla and this is the mandible. These are his lower teeth. And you can see right here, this kind of jaggedy line heading all the way through. That's a full fracture. This is through the right side of the mandible right there. And the body's trying to heal it, but it's not all the way healed yet. So there's still some instability right there. It's still an unstable fracture. So he's probably really cautious still. Like, we're not going to be able to evaluate. See right here? Yeah. But his teeth look to be okay. I mean, this is normal, right? Like, he's got baby teeth, and he's got his 4-year-old tooth coming in here. So he's got a really good chance. You can see there's that fracture line on the DP view. He kept moving his head. Yes. He was very good for pose. Okay. This cute little stud colt is about 3.5. He's got his 3.5s and his 4.5-year-old tooth. You can kind of see it starting to come in. Our Coggins paperwork only lets us pick a year, so I put him 3 instead of 4. He is a little stud colt, and you can see on his mandible right here, he's got kind of a bump. So sometimes treats can be diagnostic. I started by trying to offer him one, and he wasn't able to open his mouth all the way. So this is a pretty low body condition score for a young horse. And we took some x-rays and documented that he actually fractured the right side of his mandible. Fortunately, the left side, so his jawbone over here is broken. The left side is completely normal. And it looks like that fracture only happened about 3 weeks ago. The body is trying to make a bridge, but it's still an unstable fracture. There's still a complete fracture line. So we're gonna put him somewhere where he can eat a soupy mash and try to help support him through that. He's not very painful on palpation, and he's young, and his teeth roots all look fine, which is another big variable. So hopefully we'll support him through that acute phase until that fracture is more stable. And then we'll have to schedule him for castration. I'm not gonna be your favorite person. But he's just a lovely little guy. He's been really gentle and cooperative. This is him not sedated. So I'm really hopeful for him, and that we can get him through this broken jaw.
Today started off really calm and nice. The first group of horses we got were from a different scenario we're working out, and we're really happy they came here, and they were in much better condition than the second load. That was like crisis triage moment.
Yeah, we only had to make one decision for the last act of kindness from that first group of 8. And it was a mare who was in her upper 20s who was colicking and had cardiac disease, and she kept kind of going up and down. But the second group was in really terrible shape. He had a little donkey in his 30s who was down and getting stepped on in the trailer. And just, if you watch Horse Plus all the time, you already know this. We have absolutely no control over how these animals are transported. We literally intercept them as they're headed to slaughter. So we are also appalled by the conditions in which we receive these animals.
I went behind the barn and cried. But at auctions, they're delivered like that all the time. These traders are dumping them off. Nobody's seeing, nobody's saying anything. It's just common, and it's horrifying. But in the slaughter pipeline, it's common. But I'm really thankful they were able to come here. We were able to help them. It's been a really smooth, easy day, despite all the really hard things we had to see.
I would call it an efficient day.
An efficient day.
I wouldn't call it an easy day.
That's a good word. Efficient. It just felt there was a moment of just horribleness that we had to get through. But after that, it just flowed again, and it was, but very efficient.
It's also really rewarding to have animals that are in really severe pain and be able to give pain medications and watch them calm down and eat and drink. And we have quite a few that need rehabilitation or surgery or antibiotics, wound care, that we're gonna formulate treatment plans for, that we have formulated treatment plans for. So that doesn't mean they're out of the woods, but it's always fun to get ones that we can fight for instead of ones that we have no choice to make but the last
for
act of
the
kindness.
first trailer load, for them to come and only one have to have the last act of kindness, like
that hasn't happened.
hasn't happened in a long time. So thank you so much for watching and following along. Please find that donation link. It's probably in the description of this video or the donation button, and please support, because as Dr. Lydia loves to say, I don't make the organization money. I just spend money.
I just spend all the money. And it is really amazing for me as a clinician working for a humane society that I don't have to ask. I just do what these animals need. And that is never cheap. And so for Horse Plus to be able to do that, they're dependent on you guys, their supporters. So thank you for what you do. It helps us save a lot of animals. We try to be as efficient and as inexpensive as we can, but also we have to practice evidence-based care. We have to do due diligence. We don't want to cut corners. We don't ever want to make a euthanasia decision prematurely. And those things are all expensive and time-consuming, and it's just amazing to have the tools, but also the staff, really well-trained staff who's able to keep their energy calm and working with horses that have been through a really traumatizing day and come and immediately start decompressing makes a big difference for those animal psyches and how they view us as the weeks go on, as we continue to try to provide care. So thank you.
It's about $1,000 for just the first day for the rescue cost and just initial care that you've seen these animals get. But then there's the feeding and the quarantine and the training and all of that goes into it. But it's significantly cheaper per animal. Horse Plus is always about $1,000 per animal that we help. If how your donations work, there are some other organizations, horse organizations. I did the math, and it was like $23,000 per horse.
What?
$5,000 per horse. It's unbelievable, but I can tell you, your donations, we make it go as far as possible with as many lives as possible. So thank you.